Hello, this is Medical Science Lecture. I am delighted to have you back. If you've been married for a period now and you've not had a child, and it has been a thing of concern to you, you've been so worried, you think you're infertile, you think your husband is impotent, so many thoughts have come to your mind. Today, I want to tell you how you can get pregnant fast. Which is why you have to sit calm at the comfort of your living room to listen to this video. Everything that will be said in this video, put them all to practice. You will see yourself getting pregnant as soon as possible. Just to let you know, in this channel, I give medical tips and medical education to our esteemed viewers, even at the comfort of their living room. Again, I run classes for student of physics, chemistry, and mathematics. Once again, my name is Dr. Godwin Obono. In case you're new to this channel, please hit the subscription button, turn on your notification bell, drop your comments. If there are problems, there are questions you want to ask, drop all of them at the comment section, share, like the video, and for all subscribers, I want to say thank you very much. Let's begin. Welcome back. If you want to get pregnant, it's important for you to meet your partner during your fetal window. It therefore means you need to know your fetal window. And how do you know your fetal window? You must first know your date of ovulation. I have made a video on how to calculate your date of ovulation. I've equally done a video previously on how to calculate the length of your menstrual cycle. But right now I have to mention or tell you a few things about how to get your date of ovulation, because you need to know that date of ovulation before you can calculate or work out your fetal period or fetal window. Now there are four ways you can possibly know your date of ovulation. One is a method of calculation. You can do that by calculating. Now for you to do that by calculating, you need to know the length of your menstrual cycle. For those who do not know how to calculate their length of menstrual cycle, please go for my video on how to calculate your length of your menstrual cycle. I will drop the link at the comment section. So once you know the length of your menstrual cycle, the next thing you need to do, find out if it's regular. Is your menstrual cycle length regular? For those who have regular menstrual cycle, you now look for the midway of the length of your menstrual cycle. That will be the expected date of ovulation. What am I trying to say? For instance, somebody who has 28-day cycle has the length of our menstrual cycle and is found to be regular. Being regular means that within a period of 6 months, if this woman continues to see menses within 28 days, if she has a length of menstrual cycle to be 28 days, and for within 6 months, it has always been 28 days, and she has never missed her menses, it therefore means that she has a regular menstrual cycle. And so for her to know the date of ovulation, she will look for the midway. So for 28-day cycle, midway will be 14th day, the 14th day of a menstrual cycle, not the 14th day of the month. Please take note, it's not the 14th day of the month, but the 14th day of that person's menstrual cycle. So now, if she had known that it is a midway of her length of menstrual cycle, the next thing she has to do is to calculate, take 5 days prior to that date. 5 days prior to that date. Now, why are we looking at 5 days? The reason is that 5 days prior to that date is your fetal window or fetal period. The reason is that if you have sex in between that day, the sperm stays in the woman for 5 days, which is why we are saying that 5 days prior to that date will be your fetal window. If you meet your husband or your partner within 5 days to your date of ovulation, you're expected to, there is high chances that you get pregnant. And the closer you are to that date, the greater the chances that you will get pregnant. Now that's one way. How about if the woman has irregular menstrual cycle? For instance, a woman has irregular. When is a woman said to have irregular menstrual cycle? When the date length of menstrual cycle continue to change. Maybe this month she has 21, another month she has 28. You see her having 30 again. You see, and again some days there are months she will not see her menses. So there is irregularity in our menstrual cycle. For such persons, you will not be looking at midway of a length of menstrual cycle. So for that reason, if you must know the date of ovulation, go and look and watch my video on how to calculate the length of the ovulation day of a woman whose menstrual cycle is irregular. Now, I've told you that's the first one way you can possibly know the date of ovulation. The other method is looking at the signs and symptoms that you see around that period. Some women will say they used to have changes in their vaginal mucus. While there are some women who will notice that their breast becomes larger or heavier. Or tender. Some women will tell you that their breasts at that time, the breasts tend to be tender. Tender means if you touch the breast, it will be painful. Now, once they begin to notice such a thing like that at any point of the month, they conclude that is a period of their ovulation. While there are some who have a rise in body temperature, some may even have pain within the lower abdomen. So all these signs and symptoms or signs and manifestation, they may not be too reliable. There are some persons, it might be reliable for some, it might not be reliable for some other persons. So it may not be, it's 100%, not 100% reliable. Now, but another more reliable method of knowing the date of ovulation is using what we call the ovulation prediction kit, or the ovulation test kit. Now, the test kit, how it works is that it tries to tell you or dictate or read or measure the amount of luteinizing hormone in the woman at that given time. Remember, there is a hormone called luteinizing hormone. This is one of the female hormones. Apart from follicle stimulating hormone and estrogen, we have the luteinizing hormone. The luteinizing hormone is the hormone that is responsible for the release of the egg from the ovary. Usually, the levels of luteinizing hormone is low during the period of menstrual cycle, but it now begins to increase as the follicles are developing in the ovaries. As the follicles are getting matured at the ovaries, the luteinizing hormone continue to rise. And when the luteinizing hormones get to a very high level, it is that high level, that time it gets to the high level, that would likely coincide with the time the egg must have if I'm to use a word, is fully ripe for it to be released. And again, you can say that is the time the ovarian follicle are fully matured, or the egg is fully ripe for it to be released. So what the test kit does is that it gives you, once the test kit reads positive, if it reads positive, it means that luteinizing hormone levels in the woman at that time of measurement is very high. Likely 2 to 3 days, the egg will be released. So with that, the woman can meet her partner. Once that is detected, the woman can meet her partner with the expectation that 2 to 3 days, the 2 to 3 days, the egg will be released. And if she meets her partner at the day, perhaps the day that test was conducted and it was positive, that very day, if she meets her partner that very day, the sperm will stay for 5 days in the woman. So it's expected that the egg will be released within that time frame, and it will be released to meet the egg while the sperm is in the woman, and there is high chances that she's going to get pregnant. The idea is that you need to know the date of ovulation and then have intercourse with your partner, just few days, either 5 days to that day. And like I said, the closer you have sex to your partner, the closer you have sex to that date, the higher the chances of getting pregnant. Now, another method you can know the date of ovulation, because the whole story is centered on knowing the date of ovulation. And so the other method you can probably use to know the date of ovulation is using the radiographic test. We call it ultrasound. If you do an ultrasound, ultrasound will show that the the ovarian follicles are fully ripe or fully matured, and you'll be now advised, the woman will be advised by the operator or by the doctor that this from the ultrasound findings, the ovarian follicles are fully matured, and it is very likely that in few days the egg will be released. And so once that is the woman is told that the egg will soon, of course there can be an estimation as to how long it will take for the egg to be released, going by what the ultrasound result is showing. So ultrasound shows how mature the ovarian follicles are, how ripe the egg is, and so the woman can now be advised to go meet the husband about that time, so that with expectation that 1 or 2 days the egg will be released to meet the sperm that must have already been released into the woman. So most times, once you know the date of ovulation, like I've said, there are 4 methods you can possibly know. I know that ultrasound will require you to go spend money because you have to go and see a sonographer. But the test kit can be done even at the comfort of your home. But the calculation can also be done with you. Those ones by you. That does not require you money, spending money. But in all of that, knowing the date of ovulation and then trying to meet your partner about that date will increase your chances of what? Because the chances of getting pregnant. The problem most women have is that they always sometimes have intercourse with their partner, with their husband, at the date that is outside the fetal window. They have intercourse outside the fetal window. The period they are not fertile. So again, go and watch my video on how to know your safe period, the unsafe period, and ovulation date. So at this point, I want to believe that I've been able to inform you on how to increase your chances of getting pregnant as fast as possible. In case you have any question, please drop all at the comment section. Again, do not fail to subscribe, do not fail to share and like the video. For my old subscribers, once again, I say thank you.